Just a nurse. That's what Dr. Pierce had said in rounds 3 weeks ago, loud enough for the entire pediatric floor to hear. Not looking at Ashley Cooper directly. Never looking at her directly. Just speaking into the space above her head like she was furniture, something to be moved around but never acknowledged. The fluorescent lights hummed overhead, steady and relentless, as they always did at Cedar Creek Medical. The kind of hum that got into your bones after enough hours under them. Ashley didn't flinch. Didn't blink. She had stood there in her faded scrubs, the left shoulder seam coming loose, the hem a quarter-inch uneven from 6 months of overtime shifts, and listened to him explain pediatric pathology to the residents like the nurses in the room couldn't possibly understand the difference between a reactive airway and early sepsis. She had moved to Emma Dawson's bedside and checked the fall line, her hand steady. Precise. The kind of steady that came from having held field dressings in a bombed-out compound while rounds impacted the walls around you, but Dr. Pierce would never know that. Nobody at Cedar Creek Medical would ever know that. The night before, alone in her apartment's kitchen at 2:36 a.m., Ashley had pressed her palm against the faded unit patch sewn inside her jacket lining. Touched it like a rosary. The patch was soft from handling, the embroidered Ranger scroll barely visible after so many years kept hidden, tucked away in a place where no one would ask questions about its origins. In the morning, before her shift, she had performed the same ritual she performed every morning. Supply closet door closed. 30 seconds of silence. One hand on the patch. Then back to work. The problem with Emma Dawson was that nobody was seeing her. That was the phrase that kept cycling through Ashley's mind as she made her rounds on the pediatric floor. Not seeing. 7-year-old Emma had lost 8 pounds over 93 days. Ashley had done the math, written it down on a personal notepad that she kept separate from her official charts, the way she'd been trained to keep certain things separate, compartmentalized, invisible. 8 pounds on a child who weighed 62. That was a 12.9% loss over 3 months. The kind of number that meant something. The kind of number that whispered at you. 10 different physicians had examined Emma. Ashley had counted. Pediatrician from internal medicine. 2 hospitalists rotating through. The gastroenterology consultant who had spent 40 minutes ordering tests. The infectious disease specialist. The metabolic disorder specialist. A visiting cardiologist. 2 radiologists reading the same scan images. The emergency department attending who'd done the initial assessment. 10 different doctors, and none of them had asked the question that Ashley had asked herself the first time she'd looked at Emma's chart. Why is a 7-year-old losing weight that fast while her parents look that terrified? Captain Marcus Dawson had the hollow eyes of someone who'd seen things that didn't have words for them. 11 deployments, maybe 12, Ashley didn't ask, but you learned to read the signs. The way he stood at parade rest even when standing wasn't required. The scar tissue visible on his forearms where the uniform ended. The way his gaze tracked to the exits in any room, automatic as breathing. Army Ranger, decorated in ways that probably didn't have official documentation anymore. The kind of soldier who came home different because the things he'd done required him to be different. She had seen him watching Emma yesterday while the gastroenterology fellow explained stool studies. Not listening to the words. Just watching his daughter's face for pain. That was the difference between somebody who loved a child and somebody who was just moving through the motions. Ashley knew the difference. She had learned it watching people from 7,000 miles away, watching families say goodbye to people who weren't coming back. The trauma bay call came at 8:14 a.m., a 2-vehicle rollover on I-25, and Ashley was not assigned to trauma, but she was in the corridor when the ambulance crew rolled in with a man whose left forearm was lacerated from wrist to elbow, the skin gaping like something that wanted to stay separate. The emergency department was at capacity. The trauma bays were full. The waiting room was standing room only. The resident on duty was a 3rd year, competent but slow, and the attending was in surgery. The man was conscious. That was the first thing. He could see what had happened to his arm, and he was trying very hard not to scream, but the trying was costing him everything. Ashley had moved without being asked. Not hesitating. Not checking with anyone. Just moved. Someone had to do it. The sterile field was set up in a trauma bay's corner station, the irrigation kit already deployed, the resident already assessing the damage with the kind of clinical eye that meant he knew what he was looking at but was calculating whether he had the bandwidth to suture an arm laceration that was going to take time he didn't have. 47 minutes minimum. Maybe 50. I can close it, Ashley had said. 10 words exactly. The resident had looked at her. Looked at the gaping wound. Look back at her. Your pediatrics. Doesn't matter. I can close it. She had not asked. She had stated. There was a difference. The resident, overwhelmed and aware of it, had nodded and moved on to the next patient in line, the next crisis, the next moment where someone was bleeding and afraid and needed help that wouldn't wait for hierarchy. Ashley had pulled on sterile gloves and sat down and looked at the wound for exactly 3 seconds. The edges were clean. No debris. No contamination. The bleeding was controlled. The laceration followed a line of least tension along the forearm, which meant it would heal without colloid scarring if the closure was meticulous. 2.0 sutures. A running subcuticular stitch with a buried knot, the kind that left no marks, no obvious stitching pattern, just a clean line. The kind that combat medics learned in field conditions where the patient might have to move fast or fight their way out or do anything except stay still while wounds healed. She had not thought about that. She had simply done what her hands knew how to do. The needle had gone through skin the way a needle goes through skin when you've done it hundreds of times, when your muscle memory is older than your conscious mind. Tissue approximation. Tension balanced. The sutures placed with the spacing of someone who had practiced this in darkness using only tactile feedback, in vehicles moving fast, in conditions where you couldn't afford to be slow. The subcuticular layer first. Then the dermal layer. Then the epidermis, each suture placed with precision that belonged in an operating theater, not a trauma bay corner. The man had watched her work. His breathing had slowed. The panic had drained out of his face as he realized that whatever had happened to his arm, someone who knew what they were doing had taken control of it. 23 minutes. That was the total time. 23 minutes from the first suture to the final knot. The wound was closed. The scar would be barely visible. The function would be uncompromised. Pain medication was going to help. Occupational therapy would help. Time would help. But the closure, that was done well. That was when Corporal Hayes had appeared at her shoulder. He was military. That was the first thing Ashley registered. The uniform was civilian but the bearing wasn't. The way he stood. The way his eyes tracked the room. The kind of presence that came from too many dangerous places, the kind of invisible weight that certain people carried. He was older than her by maybe 5 years. Mid-40s, probably. Hands that had seen calluses and scars and things that didn't show on the surface. That's a combat stitch, Corporal Hayes had said. Not a question. A statement. The kind of statement that meant he had watched someone do exactly that before, in exactly those conditions, in places where the skill was measured in lives that kept moving instead of lives that stopped moving. Ashley had not looked up from tying the final knot. Had not acknowledged the words. Had simply secured the closure, stepped back, pulled off her gloves, and walked back to the pediatrics floor without responding. The mask had stayed in place. Perfectly composed. Perfectly empty. Just a nurse who had done a procedure. Nothing more. But her hands had trembled for exactly 3 seconds in the supply closet, and she had touched the patch sewn inside her jacket lining, and she had been very careful not to let her hands tremble anymore. Emma Dawson's vitals were stable when Ashley returned to the pediatric wing. Heart rate 84, age appropriate. Blood pressure 92/58, age appropriate. Oxygen saturation 98% on room air, normal. But Emma's weight was still 8 pounds gone. Still. And the tests that the 10 doctors had ordered were all coming back normal or inconclusive or labeled non-contributory to patient presentation. Ashley stood at the nursing station and looked at Emma's chart. really looked at it. The way she had learned to look at intelligence reports in another life, in another time, when looking carefully meant the difference between people coming home and people not coming home. She traced her finger down the lab values. The metabolic panel was normal. The complete blood count was normal. The thyroid function tests were normal. The celiac screening was normal. The inflammatory markers were normal. But a child did not lose 12% of body weight for no reason. The body didn't do that. The body had reasons. Those reasons just had to be found. Emma's father was sitting in the chair beside her bed, his eyes closed, his body bent into the shape of someone who had learned to sleep anywhere, in any position, because rest was a luxury that happened when you could grab it. The kind of exhaustion that came from stress and fear and keeping vigil over something you couldn't control. Ashley checked Emma's foresight. The line was patent, the dressing clean, no signs of infiltration or infection. She adjusted the 4 pump rate without being asked, a small correction that one of the other nurses might not have noticed, but the mathematics of fluid intake was important. The body needed water. Malnourished bodies needed water even more carefully calculated than normal bodies. Her numbers don't make sense, Ashley said quietly, speaking to no one in particular, speaking to the chart itself. One of the other nurses, Jessica, looked up from the supply cart. What do you mean? The tests are all normal, Ashley said. But she's not normal. She's losing weight. That's data. That's a symptom that means something. Jessica glanced at the chart. Look back at Ashley with something that might have been curiosity or might have been concern. Dr. Pierce said all the tests are ruled out. Doctors don't rule out the obvious, Ashley said. They rule out tests. But even as she said it, she knew it was a statement that didn't go anywhere, not in this institution, not in this moment. Not while she was just a nurse with faded scrubs and a limp and eyes that stayed down in rounds and no authority beyond the ability to catch things that other people missed. The authority to catch things didn't matter if no one was listening. She returned to her charts. But that wasn't the worst part, because that was when the intercom crackled to life, and a voice on the pediatric floor called a code that made Captain Marcus Dawson's eyes snap open, and everything that had been carefully balanced was about to come apart. Emma Dawson's room smelled like antiseptic and fear. Captain Marcus Dawson sat in the vinyl chair beside his 7-year-old daughter's bed, his ranger posture deteriorating with each passing hour, his shoulders folding inward like a man who'd faced insurgent fire but couldn't face his own child's failing body. The monitors beeped their mechanical rhythm, steady but not reassuring, because steady didn't explain the weight loss, the tremor in Emma's hands, the way she slept 14 hours a day now instead of the 8 she should. Dr. Pierce entered at 9:22 a.m., his white coat pristine, his timing perfect. Ashley was adjusting Emma's for when he positioned himself at the foot of the bed, loud enough for the hallway to hear, clinical enough to sound concerned. Captain Dawson, I wanted to address something Nurse Cooper here has been pushing. Pierce smiled, the kind of smile that looked generous to anyone not watching his eyes. She has some creative theories about your daughter's condition. Ashley's hand stilled on the 4 line. She didn't look up. Theories, Pierce continued, that somehow 10 board-certified physicians across 3 specialties have all missed something obvious. His voice was smooth, conversational, the tone of a man explaining a child's misunderstanding to a parent. Our nurse here seems to believe she's identified diagnostic patterns that eluded radiology, endocrinology, gastroenterology. Tell me, Nurse Cooper, which medical school granted you diagnostic privileges? The question hung in the air like a threat. Ashley's jaw clenched, but her voice remained level, measured. Her potassium levels combined with the hyperpigmentation on her palms suggest. A yes, Pierce cut her off with a theatrical laugh that made Emma flinch. Our little Dr. Google has been reading again. I apologize, Captain, that clipboard here is wasting your time with outdated assessments instead of doing her actual job. Adjusting pillows. Fetching ice chips. The tasks nurses are actually trained for. The silence that followed lasted 3 seconds. In those 3 seconds, Ashley's hand moved to the chart clip to the end of Emma's bed. She wrote something, her initials, a timestamp, a notation, with the precision of someone documenting evidence. Not for herself. For later. For when the record would matter. Captain Dawson's eyes narrowed. He'd been reading something in Ashley's composure that military training recognized, the calm of someone who'd already decided to survive worse than this. But Pierce was already moving toward the door, already turning his attention to the next patient, his work here done. The break room that afternoon was a geography lesson in exile. Ashley unwrapped her sandwich, turkey on wheat, no mayo, the same lunch she'd packed for 6 days in a row, and sat at the small table by the window. Outside, Denver rain hammered the parking lot in sheets, each drop hitting the asphalt like applause that nobody was clapping for. Nurse Jenkins came in first, grabbed her container of pasta salad. Nurse Rahman followed, his eyes fixed straight ahead, his shoulders apologetic but resolute. 2 others, Brittany from the night shift and Marcus from respiratory, gathered their things in coordinated silence. The message was wordless and total. Pierce had been thorough. He'd told them Ashley fabricated her nursing credentials. He'd mentioned her license was under review. He'd made clear that association with her meant career suicide, slow and methodical, the kind that started with whispers and ended with no calls being returned. Jenkins caught Ashley's eye for half a second. Looked away quickly. That half second of contact held an apology that would never be spoken. They left together. The door clicked shut. Ashley sat alone with her sandwich cooling on its wrapper, the rain hammering outside, the fluorescent lights overhead casting everything in a sickly institutional glow. She ate anyway. Slow, mechanical bites. Finished the whole sandwich. Folded the wrapper into a precise rectangle and put it in the trash. Pain is information. Her hands were steady. Her breathing was steady. She was still here. But that wasn't the worst part. At 3:15 p.m., Dr. Pierce posted his write-up on the unit board during shift change. 15 staff members saw it before Ashley did. The paper was printed on official hospital letterhead, her name centered at the top like an accusation, scope of practice violation, A. Cooper. The text was measured, calculated, lethal. Nurse A. Cooper has repeatedly overstepped professional boundaries by questioning physician judgment without clinical basis. On multiple occasions, she has presented unsupported theories regarding patient care that contradict established medical assessments from multiple physicians. This behavior demonstrates a fundamental misunderstanding of scope of practice and creates liability for Cedar Creek Medical. Documented instances include improper communication of diagnostic suggestions to patient family members, circumventing physician consultation protocols, and presenting herself as having diagnostic authority. This conduct is unacceptable and will be addressed in formal performance review. The signature was pristine, Dr. James Pierce, M.D., Pediatric Medicine. Ashley read it with her coffee cup halfway to her lips. The coffee was lukewarm by then, the cream congealed slightly at the surface. She set the cup down with mathematical precision, as if any sudden movement might shatter something. Her eye scanned the words, absorbing every phrase, committing the language to memory. Not because she was hurt, pain is information, but because she was cataloging. Building a timeline. Documenting the architecture of her own destruction. She walked back to the nursing station without a word. Clocked back in. Resumed her rounds with Emma, her vital checks, her for monitoring, her observations that no one would believe and 10 doctors had already discounted. Captain Dawson was sitting in the chair beside Emma's bed, his ranger discipline barely holding his fear in place. He watched Ashley work. Really watched her. The way her hands moved with surgical precision on the fall line. The way she checked Emma's skin turgor, her capillary refill, the small signs of dehydration that the specialists hadn't listed as significant. The way she didn't look at him, not because she was ashamed, but because she was focused on one child whose body was telling a story that everyone else was refusing to read. That evening, a corporal named Hayes from the Army Medical Corps arrived as part of a civilian transition program. He was shadowing the pediatric unit, observing workflow, learning hospital protocols, a bridge between combat medicine and civilian healthcare. He was 32, with the kind of focused attention that came from working in trauma situations where hesitation cost lives. A teenager came into the unit at 5:40 p.m. with a deep laceration on his left forearm, blood soaking through a makeshift bandage. Bicycle accident. The on-call resident was stuck in the OR. The ER was overflowing with a 3-car pileup on I-25. Ashley took the case. She set up for suturing with practiced efficiency, drawing the local anesthetic, preparing the field, positioning the teen's arm under the overhead light with the movements of someone who'd done this 1,000 times. Hayes watched from the corner, professional curiosity becoming something else. He saw her hand positioning, the specific angle of needle entry, the angle of tension, the rhythm of the stitches. Combat efficient. Designed for speed. Designed for field conditions. Designed for situations where you didn't have a surgical suite or unlimited time or backup standing by. That's a combat stitch, Hayes said quietly, stepping closer. Where do you serve? Ashley's hands paused. 1 second. Less than a second. A micropause that screamed classified to anyone trained to recognize it. You're mistaken, she said, her voice flat, measured, the voice of someone shutting a door that couldn't be reopened. She continued suturing without looking up. Civilian technique. Different schools teach different methods. Hayes opened his mouth to press, but something in her posture stopped him. The kind of composure that came from having survived things that left permanent marks. He backed off, nodded, stepped away. But he watched her differently after that. Recognition sparked in his eyes. Not certainty. Not yet. But the beginning of a question that wouldn't leave him alone. Meanwhile, Emma's condition continued its slow deterioration. Her weight dropped another 2 pounds between Monday and Wednesday. Captain Dawson stood in the hallway outside her room at 6:22 p.m., arms crossed, the Ranger patients finally cracking at the edges. He saw Ashley coming out of the supply closet with fresh fur bags. "What do you really think is wrong with my daughter?" he asked quietly. Direct. The way soldiers asked questions. Ashley glanced toward the nursing station. Pierce wasn't watching at this moment, but he was always watching. Always calculating. "I think," she said carefully, each word weighted, "that Addison's disease presents with chronic weight loss, hyperpigmentation, and electrolyte imbalances that could explain everything. I think it could explain the darkening on her palms, the salt cravings you mentioned, the way her heart rate spikes when she stands. I think 10 physicians might have missed it because they were each looking at one piece instead of the whole picture." Dawson's eyes narrowed. "You don't talk like just a nurse." Ashley walked away before she could say something that ended her oath of silence. Before she could tell him about Bagram. About the field hospital. About the 11 hours. About the faded unit patch sewn inside her jacket lining, the one she'd kept hidden for so long that keeping it had become another kind of scar. Before she could tell him that Captain Marcus Dawson was standing in a hospital in Denver with his dying daughter, and the only person who'd figured out what was wrong with her was someone he couldn't trust, someone who'd been systematically dismantled by a man with a title and no conscience. She returned to her charts. Her hands were steady. Her composure held. But Captain Dawson watched her walk away, and something in his military training recognized what Dr. Pierce had failed to see: the quietest person in the room was the one holding everything together. Emma's skin had taken on a bronze undertone by Thursday morning, a subtle shift that most people wouldn't notice, but Ashley saw it the way a pilot reads instrument drift, the way a trained eye catches the single millimeter that means everything. The girl sat in bed picking at hospital oatmeal, pushing the spoon away after 2 bites. Her father, Captain Dawson, stood by the window with the posture of someone carrying invisible weight, shoulders set in the position that came from wearing a rucksack for 147 kilometers through Hindu Kush terrain. Ashley documented it in Emma's chart: 0800 hours, patient demonstrates persistent anorexia, decreased oral intake, slight hyperpigmentation noted on face and neck, particularly over cheekbones. Nausea reported x 3 days. Fatigue disproportionate to current activity level. The medical abbreviations flowed from her fingers like muscle memory, precision, and data compressed into 3 lines. She'd filed similar notes on Tuesday and Wednesday. Each one methodical. Each one ignored. How's the pain today, sweet girl? Ashley adjusted Emma's for line, checking the drip rate, 20 milliliters per hour, standard maintenance fluid. The plastic tubing ran clear, no precipitate, no blockage. Normal. But nothing about Emma was normal. My stomach hurts, Emma whispered. And everything tastes like rust. Dysgeusia. That was what it was called. Distorted taste perception. Ashley wrote it down. She'd seen it before in the Bagram Field Hospital when soldiers developed electrolyte imbalances, when their bodies began consuming themselves from the inside. The memory arrived unbidden, a sergeant with a similar bronze tint to his skin, lying on a cot with his eyes half closed, saying the same thing, everything tastes like rust. She'd kept him alive for 11 hours until the evacuation bird arrived. But that wasn't the worst part. Dr. Pierce entered the room at 0835 hours with the attending endocrinologist, a young man named Dr. Reeves who had already reviewed Emma's labs 3 times and found nothing. They didn't make rounds together often. Pierce preferred to move through the pediatric unit alone, collecting oxygen like a storm system. But today he'd positioned himself directly in front of the chart, his posture the physical equivalent of a locked door. Viral syndrome, Pierce announced to Reeves, not to Ashley. Her symptoms align with a post-infectious fatigue picture. The hyperpigmentation is probably some residual photosensitivity from the initial illness. We'll order a repeat metabolic panel, but I suspect we're looking at a self-limiting condition. He turned a page on the chart. Turned another. His fingers moved with the deliberation of someone shuffling evidence. Ashley stood at the foot of the bed, her hands still. Waiting. Not challenging. Not yet. The nausea has increased, she said, her voice pitched low and even. The taste distortion is new. Her BP this morning was 94/58. Slight dehydration. Pierce didn't look up. Encourage oral intake. The 4 fluids should address that, Ashley continued. But the symptom cluster, fatigue, anorexia, nausea, hyperpigmentation, might suggest. Might suggest what, Nurse Cooper? Pierce's eyes finally lifted to hers. They were the color of wet slate, and they carried the specific coldness of someone who had decided your presence was an inconvenience. That you completed an endocrinology fellowship I wasn't aware of? That you've reviewed all 15 of this patient's specialist consultations and somehow identified a pattern that escaped 10 physicians? The room did something peculiar. The air pressure changed, like the cabin of an aircraft losing altitude. Emma pulled her blanket higher. Captain Dawson's jaw tightened. Ashley observed all of it without flinching, the daughter's fear, the father's recognition of humiliation tactics, the attending physician's embarrassment at the implied accusation. No, sir, Ashley said. Her voice hadn't wavered. Just observation. Then observe carefully, because I'm writing a note in your personnel file regarding boundaries between nursing assessment and medical diagnosis. You're developing what looks like an unhealthy fixation on this case. Pierce's smile was the kind you'd see on a predator that had just identified which gazelle in the herd was separating from the group. In fact, I'm going to recommend a wellness check. These kinds of behavioral patterns sometimes indicate burnout. Possibly depression. He said it as medicine. He said it as concern. The words were a trapdoor disguised as a hand extended to help. Ashley nodded once. Of course. After they left, Captain Dawson crossed the room and sat on the edge of Emma's bed, his hand finding the one small section of her arm where fur lines didn't obstruct skin contact. That nurse was right, he said quietly. His eyes met Ashley's across the bed. The eyes of someone trained to read terrain and threat assessment. About what Emma needs. Ashley held his gaze for exactly 2 seconds, enough to confirm understanding, not long enough to create risk. Then she checked the 4 medication port, documented Emma's vital signs, and prepared to leave the room. She had another patient to see, a boy on the east wing with a fractured femur, and that patient still had access to her. That boy still got Ashley's hands, her attention, her precision. For now. The shift assignment appeared in the staff portal at 1,415 hours. Ashley sat alone in the break room, the space where no one else sat anymore, the table that had become a quarantine zone of its own. Her fingers scrolled through the schedule, reading what she already understood. 3 of her regular patients had been reassigned. Her next 2 shifts were 2100 to 0600, the overnight skeleton crew, the graveyard rotation where Emma would be handled by float nurses and night shift residents who changed every 4 hours. The hours when nobody asked questions. The hours when decisions were made by people who didn't know the patient's baseline. The hum of the break room refrigerator made a grinding sound, like a machine that was slowly forgetting how to work. She pulled out her phone. No messages. No one texted anymore. The group chat that had existed for 3 years, 12 pediatric nurses sharing everything from funny patient interactions to complaints about staffing, had reduced her to a ghost member. People still posted. Just not where she could see. A text arrived from an unknown number, "Need anything?" It was from Holloway, the army medic who'd recognized her suturing technique during the trauma case last week. She'd been careful not to respond to his earlier message. Careful not to create any bridge that might lead someone back to who she used to be. But his message sat on her screen like a lifeline she couldn't afford to grab. She deleted it without replying. The personnel file revision posted at 1,622 hours. She was reading the update from the hallway outside the pediatric unit when Dr. Pierce walked past, his white coat catching the fluorescent light. He didn't acknowledge her presence. But he slowed, giving her exactly enough time to see the satisfaction in his shoulders, the way a general might pause to survey conquered territory. His email to the department appeared in her inbox at 1,645 hours, effective immediately. All nursing communication regarding the Emma Dawson case must be routed through attending physician staff only. Direct nurse to specialist contact is not appropriate for this case level. Please update your protocols accordingly. It wasn't a suggestion. It was a protocol. It had weight. It had institutional backing. Ashley read it 3 times, her hand steady, her breathing unchanged. She'd been trained for situations far more hostile than this, situations where the walls were literal and the weapons were actual, where mistakes meant flag-draped coffins and letters to families. This was administrative. This was medical politics. This was nothing compared to holding a field hospital together while mortar rounds came down and your second in command was already dead on the table next to you. But knowing that didn't make it hurt less. She logged out of her email and returned to the patient assignments. Emma's overnight care would be managed by a rotation of nurses, different faces every 4 hours, none of them knowing the pattern, none of them documenting the progression, none of them building the case that might save the girl's life. The documentation she'd already filed would sit in the electronic chart, time-stamped and official, but isolated. A voice calling from the bottom of a well. No one listening. The night shift started at 2,100 hours. Ashley reported to the unit and immediately moved to complete vital sign checks on her 3 assigned patients, none of them Emma. The ventilator on one patient wheezed its mechanical rhythm, in and out, pressure cycled and controlled. She'd heard that sound in Bagram too, in the tent where the critical ones lived or died depending on luck and how long the oxygen lasted. At 0300 hours, during the depth of night when the hospital held its breath, she walked past Emma's room. The girl was asleep, curled on her side, her skin in the darkness looking even darker, bronze turning copper, the color of old ammunition casings. The 4 dripped at its programmed rate. The monitor beeped its normal rhythm. Everything according to protocol. Everything wrong. Captain Dawson was in the consultation room with Dr. Pierce when Ashley clocked out at 0600. Through the small window in the door, she could see Pierce showing documents to Emma's father, gesturing, his posture the embodiment of professional concern. Dawson's shoulders had dropped lower than before, his hand pressed against his face. The documents were probably incident reports. Probably the fabrications already being whispered through the department, stories about medication errors she'd never made, about overlooked vitals and negligence and a nurse developing an unhealthy psychological attachment to a patient. She didn't need to hear the words. She knew how this story ended. She'd seen enough institutional violence to recognize the architecture of it. The parking lot was empty when she reached her car, just rows of asphalt and the first grey light of Denver morning. Rain had fallen during her shift, and the ground still smelled like ozone and wet concrete. She sat in the driver's seat for 4 minutes without starting the engine, her hands on the steering wheel at 10 and 2, the position she'd learned in Army convoy training 15 years ago. Emma had 4 days, maybe 5. Ashley's presence was being systematically removed. Captain Dawson was being fed false information by someone who had the institutional authority to make it stick. The silence in the car was so thick you could operate in it. Tuesday morning arrived like an accusation. 6:56 a.m. The pediatric wing of Cedar Creek Medical was still wearing its night shift silence when Emma Dawson's monitor began to scream. Ashley heard it from the supply room where she was restocking trauma shears, a sound she'd learned to interpret in her bones, not her ears. That particular alarm wasn't a routine arrhythmia. That was a patient in arrest. She moved toward the sound before her conscious mind finished processing. Muscle memory. The kind that doesn't ask permission. Emma's room. Captain Dawson was already on his feet, one hand gripping the bed rail, his jaw locked tight the way Rangers trained themselves to stay silent when everything inside wanted to break. His daughter's lips were the color of wet concrete. Her small chest heaved against the ventilator, pulling against something invisible, fighting for air that wouldn't come. Trachea deviated to the left. Breath sound silent on the right side. The clinical picture assembled itself in Ashley's mind like a tactical briefing. Tension pneumothorax. A collapsed lung compressing the heart, pushing the mediastinum, stealing what little oxygen Emma had left. The on-call resident, Dr. Morton, stood frozen in the doorway. Literally frozen. His hands hung at his sides. His mouth moved without sound. The kind of freeze that happens when the nervous system doesn't have a protocol for what's in front of it. Ashley didn't pause. She moved to Emma's bedside with the calm of someone who'd done this before, which she had, in a field hospital in Helmand Province with incoming fire and no backup and a young Marine with a sucking chest wound who'd become her reason to move faster than panic. She reached the crash cart, hand steady as surgical laser beams. The prep took for seconds. Skin antiseptic. The second intercostal space, midclavicular line. She could feel Emma's mother's eyes on her from the chair against the far wall, feel Captain Dawson's entire being narrowing down to this moment, to whether his daughter lived or didn't. The 14-gauge angiocath needle was cold in her fingers. She positioned it perpendicular to the chest wall, felt the slight resistance as the needle penetrated, and then the hiss. That specific sound of pressurized air escaping, of a chest finally beginning to decompress, was the most beautiful thing Ashley had heard in 3 months. Emma's sternum expanded. Color rushed back into her daughter's face like someone had turned a valve. The monitor's frantic screaming modulated from crisis to something that resembled rhythm. Oxygen saturation climbed, 71, 77, 84, 88. Trending up. Climbing toward survivable. The whole sequence took 90 seconds. Dr. Morton stumbled forward, his voice cracking, "Thank you." I wasn't, he stopped, just shaking his head. Captain Dawson looked at Ashley for 3 full seconds without speaking. His eyes held something she couldn't afford to recognize. Then he nodded. The kind of nod a warrior gives another warrior when they've both crossed the same river. Ashley removed her gloves. Checked the needle placement one more time. Confirmed the readings. Spoke softly to Emma, "You're going to be okay now. Just breathe." Dr. Pierce arrived 12 minutes later. He stood in the doorway exactly where Dr. Morton had stood frozen, but Pierce's posture was different. Controlled. Assessing. His eyes swept the room, the crash cart, the needle positioned perfectly, Emma's color returning, her vital signs stabilizing, and his face went absolutely cold. The kind of cold that wasn't anger. Anger was sloppy. This was calculation. He didn't say anything to Ashley. Didn't congratulate her. Didn't acknowledge that she'd just saved his patient's life. He simply nodded at Captain Dawson with the kind of sympathy reserved for parents whose daughters had complications, and left the room. By 9:03 a.m., Pierce had made 3 phone calls. The first went to the hospital CEO. The second to the chief of medicine. The third to risk management. Ashley only knew this because the charge nurse, Patricia, found her in the break room and said quietly, "He's filing." "I don't know what," but his voice, Patricia trailed off, shaking her head. "It's not good." Ashley didn't ask questions. Questions implied she was worried. Worried implied she had something to hide. She simply nodded and returned to her charting. By 11 a.m., her access badge stopped working on the pediatric floor. The system rejected it at the scanner, producing a soft buzz of denial. Ashley stared at the door, then down at the badge hanging around her neck like a small plastic verdict. She'd read the hospital policies enough times to know what this meant. Restricted access. Flagged file. Investigation. The machine had been told she was a liability before anyone had bothered to tell her directly. She walked downstairs to HR without being summoned. Better to move toward the fire than wait for it to find her. The HR director, a woman named Stephanie whose coffee always smelled like vanilla creamer, couldn't meet her eyes. That was the first sign that this wasn't about process. Process required eye contact. Process required conversation. This was about the decision already being made. "We've received a formal complaint from Dr. Pierce regarding your conduct during the emergency this morning," Stephanie said, reading from a file. "Specifically, that you performed an invasive procedure, needle decompression, without physician oversight or authorization. That you violated hospital protocol regarding scope of practice. That you created significant liability exposure for Cedar Creek Medical." The patient was in arrest, Ashley said. Her voice was level. The resident was incapacitated. The patient would have died in another 90 seconds. "I understand." Stephanie's fingers tightened around her pen. "But you don't have admitting privileges. You're not credentialed for invasive procedures. You can't just..." She stopped. Started again. "There's also a pattern. Dr. Pierce submitted additional documentation showing previous incidents where you've overstepped your scope of practice. Recommending diagnoses. Questioning physician orders. Going outside your authority. The fabricated reports. The ones Pierce had been building for 3 months. The ones that had turned her clinical observations into evidence of a personality problem. The ones that transformed her from a nurse trying to help a child into a rogue employee threatening the hospital's accreditation. Those reports mischaracterize, Ashley began. "Your employment is terminated effective immediately," Stephanie interrupted. "For violation of hospital protocols and patient safety standards. We'll process your final paycheck. You'll need to return your badge and credentials by end of business today." The words landed in the space between them like stones. Final. Immediate. The door closing the way doors close when they're supposed to stay closed. Ashley noticed she could hear the air conditioning cycling through the vents above them. She noticed the fluorescent lights buzzing their thin, relentless hum. She noticed that her hands, which had just saved a 7-year-old girl's life, were about to lose access to the place where that girl was still lying in a hospital bed, still critically ill, still needing someone who actually understood what was wrong with her. She set her badge on Stephanie's desk. "I'll bring my credentials back tomorrow," she said quietly. The drive home was silent except for the sound of rain beginning to fall against the windshield. Denver rain in the afternoon. Soft but persistent. The kind that comes from nowhere and decides to stay. Ashley's hands gripped the steering wheel at 10 and 2, the same position she'd held a rifle through 3 combat tours. Training dies hard. Even when you're not holding a rifle anymore. She sat at her kitchen table at 4:15 p.m. with the rain hammering the windows and wondered if this was what drowning felt like. Not the panic of it. Just the sinking. The weight of water that you couldn't fight because it was already inside you. The oath she'd sworn in 2009 came back to her then. The one Pierce had triggered without knowing. The classified operation. Operation Buried Shield. The order that had redacted her from all official records and told her to disappear into civilian life like Captain Ashley Cooper had never existed. Like Night Angel was just a story someone told about someone else. Like she was supposed to spend the rest of her life being not quite real. She'd become a nurse to save people who couldn't be saved by the people with authority to do it. She'd taken a job at Cedar Creek Medical because a ranger didn't stop being a ranger just because the war was supposedly over. She'd watched Emma Dawson decline for 3 months while 10 doctors missed what was wrong because they weren't looking at the patient. They were looking at the chart. Looking at the precedent. Looking at the algorithm. And when Ashley had looked at the actual child and seen Addison's disease, when she'd tried to save her, she'd become the problem. The kitchen door opened at 4:44 p.m. Her son, Marcus, named after the first man she'd served under, though he didn't know that, came through with his backpack and his sophomore year and his complete unawareness that his mother's life had just ended with a signature on a HR form. "Hey Mom, why are you home? You're always working Tuesdays." He stopped. He saw her face. Saw the kitchen table. Saw his mother sitting motionless, her hands folded in front of her, and something in him recognized that this wasn't a normal conversation. Ashley tried to speak. Opened her mouth. Found there was nothing she could say that wouldn't be a lie or a truth she wasn't allowed to tell. So the tears came instead. Not from her eyes going red or her composure breaking, but from something deeper. From 15 years of carrying a classified rank she couldn't use. From watching a child die in slow motion while 11 doctors prescribed antacids. From being fired for saving a life. "Mom." Marcus set down his backpack. His voice shifted into something older than 15. Something that knew how to recognize trauma. "What happened?" "I can't explain," Ashley whispered. But that wasn't entirely true. In the attic above them, hidden in a weathered box under old tax returns and Christmas decorations, was a shadow box containing medals she'd never worn in public. A bronze star. A silver star. 2 purple hearts. And folded beneath them, a citation that started with the words "for extraordinary valor" and ended with a rank and a name that were supposed to be dead. All of it was about to come down. The hospital lobby transformed in real time. Captain Marcus Dawson stood before the Board of Trustees, his dress uniform pressed to knife-edge perfection, and his 15-year-old son beside him held a shadow box like it weighed 1,000 pounds. Inside it, the medals Ashley had kept hidden in their attic for 15 years. Bronze star. Silver star. 2 purple hearts arranged on dress blue velvet. The boy's hands trembled, not from fear but from the weight of what those decorations meant, his mother's entire history compressed into 4 pieces of metal. Dr. Pierce stood near the far wall, arms crossed, waiting for this theater to conclude so he could return to the business of being right. He had done this before. He would do it again. His power was institutional, surgical, precise. One phone call to the state medical board would take years. By then, Ashley would be forgotten. The problem was the phone in someone's pocket in the back row. A resident named Dr. Simmons had been recording for the last 40 seconds. Not with intent at first, just documenting the moment for his personal file, for evidence of what happened when you questioned a superior. The camera was still rolling when Pierce's voice cut through the lobby's sudden quiet. "This is absurd theater. She's a disgraced." That was when the Marine colonel stepped forward. Not slowly. Not with hesitation. With the kind of fluid authority that made everyone in the room understand, without being told, that they were in the presence of someone accustomed to command. His uniform blazed with ribbons. His bearing made the air pressure change. He held out a stack of photographs, 8x10s, each one crisp and undeniable. Photographs of Captain Ashley Cooper in a bombed-out field hospital in San Juan Valley, Helmand Province. Performing a cricothyrotomy on a casualty with a neck laceration that should have been fatal. Her hand steady as a surgical laser. Her face obscured by surgical mask and focus, but her movements unmistakable. The signature efficiency. The economy of motion that only came from training so intense it became muscle memory. Another photograph, Ashley stabilizing a pediatric casualty, a girl, no more than 9 years old, with an impacted airway. Ashley's hands gentle but commanding. In the background, 3 soldiers providing security, weapons raised, while she worked. In a war zone. Under fire. The timestamp read August 14, 2009. The colonel didn't speak. He didn't need to. The photograph spoke in a language that transcended hospital hierarchy. Dr. Simmons's phone captured it all. The colonel's expression, calm, almost sad. Pierce's face draining of color. The moment when the lobby realized what it was looking at. Not a nurse. A legend. By 6:41 p.m. that same evening, the video had been uploaded to YouTube. By 7:15 p.m., it had been shared across Reddit's Our Justice Served subreddit. By 8:19 p.m., it had 847,000 views. By midnight, 2.3 million. The comment section erupted like a breach dam. Dr. bullies war hero nurse. Cedar Creek Medical fires decorated Army Ranger. This is what retaliation looks like. She saved lives and he tried to destroy her. At 8:03 p.m., in a high-rise office in Washington, D.C., Dr. Raymond Haskell, Pierce's medical school mentor, a man whose career had been built on mentoring the next generation of physicians, received a text alert from his daughter with a link. He clicked it. He watched his former student, the protégé he had championed for 15 years, attempt to discredit a war hero. He watched the colonel produce the photographs. He watched the lobby go silent. At 8:36 p.m., Dr. Haskell released a statement through the American Medical Association's official channels. It was brief. It was devastating. I was honored to mentor Dr. Pierce during his medical training. Tonight, I was ashamed of the man he has become. His actions toward this nurse are antithetical to every principle of medical ethics I attempted to instill. I am withdrawing my endorsement and my support. He does not represent the values of this profession. The statement went viral within 30 minutes. Other physicians began adding their names. Other hospitals began reviewing their own conduct. Other patients began coming forward with stories of nurses they had seen bullied, silenced, dismissed. At 11:11 p.m., Cedar Creek Medical's chief of medicine made a call to the hospital board chair. They convened an emergency session in the cafeteria, the only space large enough for everyone. They brought boxes, files, incident reports. They discovered something that made the air taste like copper and ozone. None of the families that Pierce had cited in his formal complaints against Ashley existed. Not a single one. The names were fabrications. The allegations were fabrications. The entire architecture of his case against her was constructed from air. They found the shift rotation records, altered to isolate Ashley. They found the access log showing Pierce had manually revoked her badge credentials without following protocol. They found her personnel file marked with 23 separate entries, all in Pierce's handwriting, all within a 6-month span, all claiming misconduct that the actual patient records contradicted. Emma Dawson's chart alone showed that Ashley's clinical observations were not just accurate, they were the only accurate observations in the entire file. The chief of medicine made another call. To the state nursing board. To the state medical board. To the hospital's legal counsel. Within 3 hours, they had compiled enough evidence to warrant a formal investigation. Within 4 hours, they had called Pierce into an administrative conference room and informed him that his attending privileges were suspended effective immediately, pending full review. "This is a mistake," Pierce said. His voice no longer carried its practiced authority. It carried the texture of someone watching their entire world collapse in real time. "I was protecting the integrity of patient care." "You were protecting your ego," the chief of medicine said quietly. "And you fabricated evidence to do it. We've contacted the state medical board. We've contacted the FBI. You'll be receiving formal notification in the morning." By 3:17 a.m., the hospital board issued a formal statement: Dr. Pierce's attending privileges are permanently revoked, effective immediately. "We have discovered a systematic pattern of harassment toward nursing staff spanning 8 years and multiple departments. We are cooperating fully with state and federal investigations. 6 weeks later, the state medical board held a hearing. 12 other nurses came forward. 12 other cases of documented retaliation. 12 other stories of clinical observations that were ignored, dismissed, or attributed to physician recommendations instead. The state medical board reviewed the evidence for 73 minutes. They deliberated for 47 minutes. They voted unanimously to revoke Pierce's medical license. 6 months after that, on a Tuesday evening in early October, Dr. Pierce stood in front of a classroom at Denver Community College in a fluorescent-lit room that smelled like hand sanitizer and defeat. He wore a name tag that identified him as Instructor Pierce. Behind him, a plastic CPR dummy lay on a practice table, its chest waiting to be compressed by students who didn't know his name used to mean something, who didn't know he had once been published in the Journal of Medical Ethics, who didn't know he had destroyed his career because he could not tolerate the idea that a woman with a nurse's credentials might understand something he did not. His hand shook as he demonstrated chest compressions on the dummy. 30 compressions. 2 rescue breaths. 30 compressions. 2 rescue breaths. The motion was mechanical, repetitive, the kind of work that occupied the body but left the mind free to contemplate the precision of its own unraveling. His salary was $18 per hour. He taught 4 classes a week. His annual income was $37,400. The apartment he now rented in South Denver was 680 square feet. The car was a 2009 Honda Civic that required new tires. No one called him doctor anymore. No one called him anything at all. The next morning, as the sun crested the Denver skyline and turned the hospital windows into mirrors, Ashley Cooper walked back into Cedar Creek Medical through the employee entrance. Her badge had been restored. Her personnel file had been expunged. The hospital had offered her the position of Director of Nursing at a salary of $128,500 annually. She had accepted on one condition, a new protocol that required all clinical observations from nursing staff to be formally reviewed before being dismissed, and all concerns about patient deterioration to be documented in the chart with physician response, no exceptions. The lobby was different now. The staff moved differently. The culture had shifted. Nursing observations were no longer suggestions. They were data. They were clinical judgment. They were what kept patients alive. Ashley didn't go to the administrative office first. She went to the pediatric wing. She walked past the unit board where Pierce's write-up had once been posted, calling her reckless. Someone had replaced it with a new notice, printed in bold text, "Welcome back, Captain." She continued to Emma's room. The girl was sitting up in bed, color returning to her skin for the first time in months. Treatment had begun immediately once Addison's disease was confirmed. Dexamethasone. Fludrocortisone. Careful monitoring. Emma would need lifetime medication, but she would live. The hyperpigmentation would fade. The fatigue would lift. The nausea would pass. Captain Dawson stood by the window, watching the city wake up. When he saw Ashley, he moved toward her with the kind of grace that only came from military training, nothing wasted, everything purposeful. His expression was controlled, but his eyes carried the weight of the past 72 hours. He said. And it was a greeting between two people who understood what it meant to keep secrets and why secrets were sometimes the only thing that kept you alive. Ashley approached Emma's bed. The girl smiled, recognition flooding her features. "Night Angel," Emma whispered. That had been Ashley's call sign in Bagram. Only the colonel had known it. Only the soldiers who had worked with her in that field hospital understood who she really was. How Emma knew, Ashley didn't ask. Children sometimes saw things adults missed. She reached inside her jacket lining where the faded unit patch had lived for 15 years, the patch from 3rd Battalion, 5th Marines, the Ranger unit she had served with, the patch that was supposed to die with her old identity when the operation at Bagram was classified and her military records were sealed. She pulled it free carefully, the fabric soft from years of carrying it against her chest. The stitching was still intact. The colors had faded to ghost versions of their former brightness. It looked like it had survived a war. Because it had. She pinned it gently to Emma's hospital gown, right over the girl's heart. "You're a fighter," Ashley said. Her voice was different now, no longer deferential, no longer small. It carried authority earned through 15 years of silence and service. "Like your dad." Emma reached up and touched the patch, understanding without being told that it meant something. That it represented something. That it was a promise. Captain Dawson gripped Ashley's shoulder. His hand was steady. His voice was quiet. "You saved her. 10 doctors missed it. You didn't." He paused. "That takes a special kind of courage." "It takes refusing to stop looking," Ashley said. That afternoon, the hospital board convened a formal ceremony in the main auditorium. Press attended. Local news stations sent cameras. The story had become national. A decorated war hero silenced by institutional arrogance. A nurse who had served in classified operations now serving in a pediatric wing. A system that had nearly allowed a child to die because the people in charge preferred hierarchy to accuracy. Ashley stood at the podium. Her dress uniform was pressed. Her medals were displayed on her chest. Her voice carried the kind of quiet authority that made the auditorium go still. "Power is not a title," she said. "Power is the ability to help." That was all. That was enough. She returned to the pediatric wing that afternoon, her badge restored, her credibility unassailable, her past no longer locked behind classified protocols but finally visible. When she passed the unit board, she saw the new notice again, "Welcome back, Captain." And underneath it, someone had added a handwritten line, "The real healer returns." The other nurses who had abandoned her in the break room approached one by one. Their apologies were offered in whispers, in shame, in the understanding that they had been manipulated by someone who understood how power worked better than anyone should. Ashley accepted each one with grace, though her expression made clear that she had not forgotten and would not forget. Mercy and memory could coexist. They had to. If you believe that clinical judgment from all healthcare team members deserves protection and respect, that institutional power should never silence expertise, and that someone's past shouldn't determine their value in the present, please like this video, subscribe for more stories of quiet heroes, and comment below, have you ever been underestimated by someone who didn't know your real story?